All right. So then you were here 4 or 5 days ago. Today's Friday. You were here on Monday, and so far you had 3 acupuncture treatments. A recap: last visit, knees were better. Headache and sinus got worse. Back and hips were more sore, but energy in the morning seemed to be a little better, although you were still fatigued profoundly by 2 p.m. And you're still doing the cinnamon and ginger and ginseng that I recommended. And one of the first things I said would be sinus doing better. But for some reason, sinus got worse, and you resumed exercise a little bit more than you were doing before. So that's where we left off, and you did get a diet book for your body type, assuming that's what it is.
Correct.
Yeah. All right. So what transpired in the past few days?
So pretty much the same.
Okay.
Energy still strongest in the morning.
Okay.
And I could probably say a lot of that could be the ginseng.
Okay.
Less overall body pain. Knees are great. Lower back is stiff, very stiff. Starting to incorporate some of the eating suggestions in the book, assuming I am cool and dry.
Yeah. Okay.
Sinsen, yin yin, sinsen, yin yin.
Yeah, yin yin,
Yin
right?
yin,
Yeah, greater yin, lesser yin. Lesser yin is a cool type, greater yin is a dry type. It's just a different name of saying the same thing, because a human being is just so multifaceted. Depending on what you're saying, you have different names to that, right? They're coming
Yes.
from looking at from different angles.
Sure.
Yeah. Okay. So then it sounds like, because we're looking at all multiple symptoms here, some things get better faster than the other ones. Some things are staying the same. Okay. The sinus is what?
The sinus is probably worse.
Sinus
Like right
is
now
worse.
I'm hoarse.
Okay.
And it's just
Yeah.
draining.
All right. Yeah, because me being a warm type, because ginseng is warming. Me being a warm type, I take ginseng. I feel like it's a little stimulating, but I don't feel it giving me energy.
Yeah.
Okay.
Is that so?
And then that got me sick when I was age 31 to 35, 33. It really manifested. I didn't know until just my body started breaking down. And this was back in 2003 to 2005. Okay. All right. So I'm just letting you know that
Okay.
the distinguishment is important.
Yeah.
All right. Now I'm not trying to like alert here, but
no, but it
yeah.
is working
Mm.
well, and my body's agreeing with it.
Okay, and you could feel that. Okay, good.
I think so.
Yeah, yeah, yeah. You could feel it because when things are accepting, then there's a difference between driving and accepting, right? Okay.
Yeah.
All right.
Okay.
Yeah, and then overall this week you could weigh it out as a whole, doing better than last week or doing better than you first started.
I think the trend is that I am doing better, and maybe some fine tuning to kind of address some of these issues.
Okay. All right.
The knees are a serious improvement.
Yeah, I think that's great because you had acupuncture in the knees, but you also had acupuncture in the arm and the leg. My experience is that acupuncture in the arm and the leg is more effective than local acupuncture.
Okay.
I did both because, of course, in combination it would be even better. Right. So then that's an area that's noticing significant improvement. I think the only question is, okay, what's up with the sinus? That's my question. But you are experiencing more energy in the morning. It sounds more like a rested energy. Like you have more energy because you're more rested.
I'd say my sleep is interrupted still a lot.
Okay. All
I
right.
have central headaches, which are, if I were to guess, kind of more in the limbic system, the
Okay.
center. The sinuses, and I hate to use the word sinus because postnasal drip isn't necessarily associated with a sinus.
Well, okay. Yeah, I'm blanketing it. It
Yeah,
could
yeah.
be from hay fever. It could
Yeah,
be
yeah.
from viral.
Yeah, yeah.
Addresses both, even variation of the
Okay.
virus or viri are addressed with the cinnamon ginger combination.
If I were to guess, I would
Mm.
say it is possibly food related.
Okay.
But boy, I'm hoarse today.
Yeah, but for related, you got the food list and you're starting to work on it. And the type of headache you have is about the same.
Yeah, but yeah, yeah,
Okay.
for
Okay.
sure.
All right. So then I'll be adding more acupuncture and let's see how you do with this.
Great.
Okay. Head and next.